unabashed,
the most unpredictable,
becomes a headline,
the most volatile,
outrageous behavior,
unsubstantiated narratives, a battle of personalities.
Welcome to Grand Tamasha, a co-production of the Carnegie Endowment for International Peace and the Hindustan Times. I'm your host, Milan and On Sunday, India reported more than 333,000 active COVID cases, while the official number of fatalities surpassed 500 deaths. What is the state of COVID in India today? What lessons has this pandemic imparted? And what, if anything, does COVID mean for the future of economics and politics in the country? To discuss these questions and much, much more, and to kick off the 7th season of our show, I am joined today by Sukumar Ranganathan, editor-in-chief of the Hindustan Times. Sukumar has written more than 150 columns on the pandemic, if I'm not mistaken, and it's a pleasure to welcome him back to the show. Sukumar, good to talk to you.
Good to talk to you, Milan.
So I want to begin by asking you about the state of COVID in India today. You know, the number of cases seems to be rising sharply. Some signs maybe they're plateauing, but hospitalizations and deaths for now appear somewhat contained. Tell us a little bit about what the mood is in the country and how restricted is activity at the current moment.
Cases have risen very sharply, but what we are beginning to see is a plateauing in cases in the early hotspots. For instance, in Delhi, Mumbai, and to a certain extent, Calcutta, you're actually beginning to see cases either decline or in some cases plateau. You're beginning to see positivity rates go down. But at the same time, what we are also seeing is an increase in cases in smaller towns, in rural India. And that is pretty much the same trend that we saw during the first wave, when the first hotspots, the initial hotspots were the large cities and the urban areas, and then rural areas became the secondary hotspots. But the good news, and this is probably something that's given a lot of people hope, because contrary or unlike the despair, which was pretty prevalent during the fairly brutal second wave of the pandemic in April and May last year, everyone seems to be a lot more optimistic. And I think one reason for that is the fact that hospitalizations have not increased at the same rate as cases. In most states and union territories, around 85-86% of the hospital bed capacity is still unutilized. And the number of people in intensive care, or the number of people who are requiring oxygen, is a fraction of the number of people who are in hospitals. So and of course, finally, as you pointed out, the number of deaths is fewer. And not just that, in those areas where we've been able to get some data, in Delhi, for instance, we've been able to get some data on how many people who died in the current wave were not vaccinated. And we found out that in excess of 75%, and this was a very limited sample of less than 100 fatalities over a 3-day period in early January for which we have data, but we found out that over 75% of them were not vaccinated, and another 8% or 9% had received one dose of the vaccine. So clearly, the fact that many people in the cities have received, many adults in the cities have received both doses of the vaccine, has kept people from falling ill enough to require hospitalization. And I think that's the good news. You asked about restrictions. It's pretty varied. There are some states and some union territories where you have fairly stringent restrictions. Some of the others are beginning to open up. Maharashtra and Mumbai, for instance, Mumbai especially is considering opening up with a reduction in cases. Delhi has still not done so. It's relaxed some of the restrictions, but what they call a weekend curfew, which means you pretty much have a lockdown over the weekend, and you can't go out unless you're either an essential worker or a frontline worker, or you have something really important to do, like go to an airport and catch a flight, or take a sick pet to the vet, things like that. But otherwise, you're just not supposed to go out. So the weekends are completely locked down in Delhi, locked down in a few other cities as well. But some of them are beginning to open up with the cases beginning to plateau, and we are hoping that Delhi will remove these restrictions shortly.
Sukumar, I want to take you back to a column you wrote in December. And in that column, you argued that India needs to tailor its COVID response around four things: masking, ventilation, vaccines, and outbreak protocol. And let me start by asking about masking. You wrote pretty clearly that India should mandate masks, strictly enforce that mandate, and insist not just on cloth masks, but either surgical or N95 masks in all closed spaces. How would you say India is doing on this front?
Not very well. And I think it's easy for anyone who wants to enforce the mask mandate to do it in the open, right? But once you're inside an office, once you're inside a mall, I think the enforcement is in the hands of either the administration in the office or the people running the mall. And I'm not sure that's happening very effectively. It's definitely not happening in terms of the kind of masks being used. Many people still use cloth masks. And the reason I wrote that article was because we all know that, especially in the case of this variant, you need as much protection as you can get to prevent getting infected. And that means either a surgical mask or an N95 mask. And of course, I also don't think there is complete enforcement in terms of making sure that anyone who's in a closed area is masked every time they are with other people. It's not so much of a problem in open areas, which is why in part of that column, I also focused on ventilation. So open air markets are fine. Open air dining is fine. You want to go for a walk in the park, I guess that's fine. But if you want to go shopping, if you're one of those, and of course in Delhi, rules have now been relaxed. As I told you, the only rule that's been relaxed concerns people going into work. So companies can get up to 50% of their workforce officers into offices. And I don't think there is any way to ensure that everyone who's sitting in an office is wearing a mask. Those whose self-preservation skills are high are obviously going to follow this mandate, but those whose self-preservation skills are not high are definitely not going to follow it. So I think that's the reason why you're seeing this spike in cases. And you mentioned a number in excess of 300,000. I would think that the actual number would be higher for the simple reason that many people are taking home tests. And I don't even think they're reporting the fact that they're turning positive. They're just isolating along with their families.
In addition to masks, obviously we know vaccines make a big difference. You know, we were to have this conversation back in the spring of last year, there was a lot of consternation about the slow pace of vaccine, the inability or unwillingness of countries like the United States to share vaccine. We're in a much different place today. Around 50% of the population is fully vaccinated. 2/3 or more have at least one dose. However, a very small percentage, I think less than 1%, have received the booster. Are you worried that the country is not getting boosters into people's arms fast enough? Because again, the science tells us that the booster is very effective, at least in minimizing the harm posed by this new variant.
The simple answer to that question is yes. But I'd like to give a little bit of context. If you were to look at the adult population, India is fully vaccinated almost 3/4 of its adult population, right? And partially vaccinated around 87, 88, 89% when I last checked. It's in that range. And this is anyone over the age of 18. Which was the initial target segment for the vaccination. It then subsequently started vaccinating people between the ages of 15 and 18. It's managed to vaccinate partially vaccinate, because it just started that around a month ago. It's managed to partially vaccinate in excess of half that population. So the numbers are not bad. In fact, I would say, looking at where we started off, and looking at how chaotic it was in the initial weeks, and looking at the supply constraint that we had at that point in time, I think it's a fairly significant achievement. The one area where I think we may have missed a trick is really boosters, because I think we partially vaccinated around 85% of the population sometime late last year. Uh, Supplies are no longer a concern. And I think by December, if we'd wanted to, we could have started providing booster doses. And even now, if you are to look at it, the requirement is that you need to have received your second shot of the vaccine 39 weeks previously for you to be eligible for a booster. I just think that that's 9 months. I think that's far too long a gap. You could make it 6 months if you want to. You could make it 4 months if you want to, because I think research would say 6, expediency would say 4. I think so. These two areas: one, the fact that we did not announce boosters in December, and of course the fact that we are now insisting on this gap is problematic. But I have to make this point, and I've made this repeatedly in a number of my columns. The ethics of people in a certain geography getting boosters, while a vast majority of Africa, for instance, remains unvaccinated, it's troubling. And it's troubling not just from the ethical point of view, it's also troubling from the scientific point of view, because this is exactly how variants emerge. So I think you need to try and do both. Perhaps the Indian approach of just focusing on the most vulnerable population for boosters, frontline workers, as well as people over the age of 60 with comorbidities, is not so bad. Sure, it would be great to give everyone boosters. I'm all for boosters. I would love to get a booster. But I think if you're going to prioritize and say, we are going to restart our exports, which India has restarted actually. We're going to restart our exports of vaccines and allow our vaccine makers to ship vaccine doses out and meet their commitment to COVAX, for instance. And also at the same time, just focus on the most vulnerable population and make sure they're going to get boosters. I'm fine with that. Because even those with 2 doses of vaccines, and any vaccine, it's not just the Pfizer vaccine or the Moderna, even the Covishield one, 2 doses does prevent hospitalization, severe illness, and death. It might not prevent an infection, but it does prevent hospitalization and death, and that's really what you're seeing in India. Because if it didn't, by now you would have seen hospitals deluged with patients.
Well, this kind of takes me to this point about, COVID is endemic in India and many parts of the world, the United States, for instance. But you point out in your earlier piece that at any point in time, on short notice, it has the possibility to spiral into an epidemic. And you say that the fourth and final thing India needs to think about is how to invest in better outbreak protocol. What exactly does that entail? And is there a model that you have in mind, or kind of a framework for thinking about what it is that India should prioritize to prevent or protect against, maybe the next variant, which is more viral and more deadly?
I think the first thing to do is to ensure that you don't disrupt the things that cannot be disrupted. And I would put three things above all else. One, of course, is healthcare, and I don't just mean COVID healthcare, because one of the big crises that you've seen in India and in a lot of other countries around the world is usual health programs or standard health programs or routine health programs that countries carry out every year getting horribly compromised because of the fact that the healthcare system is now focusing primarily on COVID. So that, of course, so you have to ensure that your regular healthcare system, your regular immunization drives, all of those, your regular childcare schemes, all of those things are not compromised. So that's the first thing that shouldn't get disrupted. The second thing that shouldn't get disrupted is clearly education. Schools have to be the last to shut and the first to reopen. It's unfortunately not a protocol that we've followed at all in this country. Schools have been the first to shut and the last to reopen. And you're seeing the outcome of this. Learning outcomes are pretty bad. I think there's been significant learning loss. In many parts of rural India, children have forgotten what they've learned in earlier classes. So you have children in class 8 who are having problems with basic arithmetic, which a class 5 student should be able to do. So that is something that we could have done better. The third thing, of course, is to ensure that supply of goods and the manufacture of goods carries on, and you try and keep as many establishments open as you can, because you cannot afford to have livelihoods destroyed by restrictions that you put in place. And I think on education, we've not done very well. We need better protocols. And on closures, we've not done very well. I think this lockdown business or this habit of enforcing lockdowns, it's a knee-jerk reaction. I think it's lazy policy making. It might have made sense at one point in time when you had to prepare the healthcare system to be ready for the flood of cases that would come, and sure enough, they did come. But at a point in time when 86% of hospital bed capacity, COVID hospital bed capacity is unutilized, I think it makes no sense to have restrictions in place or restrictions of the kind that we have right now. Sure, you should have restrictions for social events, for weddings, for large gatherings, and sure, you need to have mandates on masks and social distancing, but it makes no sense to have a lockdown or a weekend curfew or any of those things, which is why I wrote that piece. I think you need to have something which is actually typed up, and I think if you're going to deviate from it in the best, finest manifestation of how bureaucracy works, I think if you want to change it, you should get 7 different signatures from 7 different departments, which means you can't change it at all, right? And we don't have that kind of protocol. I think it's very important that we have that kind of protocol. And so right now, and I think one of the newspapers, I think it was the Hindu today, if I'm not mistaken, carried a very interesting photograph from a place called Viluppuram, which is in Tamil Nadu, except that one half of it abuts Pondicherry, where there is no lockdown, and the other half is in Tamil Nadu, where there is a lockdown. So you have a street, and the shops on one side of the street are open, and the shops on the other side are closed.
Hey, Grant Tamasha listeners, thanks for listening to the podcast. Putting this show together each week is a labor of love, but it takes a lot of work to put out a great show every week. If you'd like to support the work we do at Grant Tamasha, please visit ceip.org/donate. Don't forget to subscribe to us on Apple Podcasts, Google Podcasts, Spotify, or on your favorite podcasting platform, so you'll be the first to know when a new episode rolls out.
You know, getting into the issue of the states here, let me ask you about India's COVID response and this thorny issue of center-state relations and federalism. You know, during the first wave, if we kind of rewind the clock, the center was accused of adopting a really draconian, top-down, centralized approach. During the second wave, it seemed to say, no, this is a health state subject. It's really the state chief ministers and state apparatus that should be in charge of health and health provision. Where do things stand today? Is there some kind of comfortable equilibrium that exists between the center and the state capitals?
I think to some extent there is. There you do have the usual political sniping that goes on. But beyond that, I do think that the center has realized that when it comes to restrictions, when it comes to last mile access, when it comes to management of COVID at the first level, a lot of responsibility is with the states, and the states are the ones that are doing it. And I think the states have realized that when it comes to things like mandating policy on sequencing, when it comes to mandating policy on vaccination, when it comes to sourcing of vaccines, then it probably makes sense to get that done at the federal level. So I think there is some kind of balance that's been achieved in that. But to be fair, I think it's been a learning process for everyone. And it's highlighted some very stark issues that we have in this country, including, for instance, the fact that over the last 3 decades, the district hospitals, which used to be at one point in time the first port of call or the first line of defense, or the place where anyone with a severe illness in a district would be sent to. I think over the last 25, 30 years, those have really been destroyed. I think the focus has been, to a certain extent, on private healthcare. And I think you're beginning to see what the presence of that very critical node in the health chain could have achieved in this pandemic.
So speaking of the health chain, let me zoom out a little bit and ask you about the broader lessons learned from this nearly 2-year-old battle to contain COVID, right? There are many scholars and development analysts who have written in the Hindustan Times and elsewhere that the pandemic has really served as a wake-up call, right? That India has to do much, much more to build basic infrastructure for public goods provision in areas like health and education. Do you think 2 years on, there are signs amongst the political class, amongst the government, that this lesson has been learned and internalized?
At this point in time, yes. To be quite honest, I don't know how long it will last. Let's assume that COVID mysteriously vanishes 6 months from now. It's unlikely to, but one can always hope. But suppose it does. 2 years from now, would we still remember all the lessons that we've learned? I don't know. But at this point in time, if you look at the behavior of both the center and the states, and even local administrations, I think everyone seems to have learned a lot. At least their actions seem to suggest that they have. There really has been a focus on trying to build healthcare capacity at every level. And I think many states do have in place some mechanism to deal with a crisis like this if it were to happen again. Again, like I said, I don't know whether this will last, but at this point in time, it looks like the lessons have been learned. I don't know whether the lessons will be remembered.
We're entering the crazy season known as budget season. The government is going to unveil its latest annual budget on February 1st. I want to ask you to reflect a bit on COVID and the economy. If we go backwards in time, prior to the pandemic, India's economy was slowing. It had suffered several major shocks, not least demonetization, the introduction and patchy rollout of the GST, the goods and services tax. If India is able to weather this new variant reasonably well, and our hopes come true that there's a sharp peak and then a sharp decline, do you think that the fundamentals are in place for a somewhat speedy economic recovery and a kind of rekindling of animal spirits that so many economists have been saying is sort of just around the corner, but we haven't really quite gotten there?
I'll answer your question in two parts. First, I'm not so sure that the current wave of the pandemic in this country is going to seriously impact the economy. It might have some impact, but I'm not sure that it's going to be a serious impact. And the reason I say this is because during the second wave, which was the most brutal this country has seen so far, and I just hope we never have to relive those days again. But during the second wave of the pandemic, there was no federal lockdown. A lot of business activities were allowed to continue. And the recovery post that phase was almost immediate. It was a very rapid recovery. So if you look at what people in India refer to as the festive season, which starts in September and goes on till the end of the year, I think the economy did very well in that period, and the numbers bear that out. So the quarter ending September last year, which is July, August, September, and July was soon after the second wave. So July, August, September, the Indian economy expanded by 8.4%. So I'm not so sure that you're going to see this wave impacting the economy seriously. So it's going to be a temporary blip. I have a feeling that the recovery or the momentum in recovery will continue. That's the first part. But then there's a second part. And here's where things begin to get interesting. Whoever you speak to, you could speak to economists, you could speak to people in the finance ministry, you could speak to economists who are critical of the way the Indian finance ministry works. You could speak to people at the Reserve Bank of India, and you'll hear pretty much the same thing, which is the fact that there is an underlying problem of aggregate demand which still needs to be addressed. It's evident in the numbers. If you were to disaggregate the GDP numbers, you will find that consumption demand is not there. A lot of the recovery is happening on account of government spending. What's even more worrying is that if you look at the Reserve Bank of India's consumer confidence indices, they're low. People's expectation in terms of income is not where it should be. It's not even where it was before the pandemic. So I think there is a sentiment issue, there is a consumption demand issue, which needs to be addressed. Unless that is addressed, sure, the economy will grow 9.2% this year, according to the government's own estimates. But I'm not sure that it is going to be the kind of beneficial growth that helped India pull hundreds of millions of people out of poverty in the 2 decades after 1990. And I think that is the issue. Some economists refer to this as the K-shaped recovery. So there's a certain segment which is doing very well, but there is another segment which is not doing very well. So one of the arms of the K is pointed up and the other arm is pointed down. And that's not just true at the individual level. I think that's true at the corporate level also. A lot of small enterprises have taken a beating during the pandemic, and many of them are not coming back. The informal sector has again suffered a lot. Initially suffered because of demonetization, then suffered because of GST. And both of these were efforts to formalize the economy. And I don't think that anyone has a fundamental issue with formalizing the economy, except that I think that this was such an abrupt way of formalizing the economy that it made many businesses uncompetitive. It made the cost of compliance high for some businesses, and it made many businesses go, down shutters, and creating even an employment problem at some level.
Sukumar, let me sort of bring this conversation to a close by asking you about the pandemic's effect on not the economy, but on politics. I think a lot of election analysts I speak to, probably ones you speak to, aren't so optimistic that, a state government's fate is going to hang in the balance based on how well or how poorly they've managed the pandemic. That there's so many other issues that matter for voters, and there's all kinds of problems about attribution, credit, blame, and so on and so forth. At the same time, I think a lot of people are rightly concerned that there's a real possibility that campaigns, such as the campaign underway in several states that will have elections coming up soon, are going to serve potentially as super spreader events, quote unquote. Do you think that the pandemic is changing either the sort of supply side of politics, the way that parties and governments behave, or the demand side in terms of how voters are interacting with politicians? Or is this all basically kind of come out in the wash and net, there hasn't really been much change during this period?
I'm going to resort to a phrase that people usually do when they don't know the answer, which is to say, excellent question. Right? But we don't know. Our sense from the field is that it doesn't seem to be mattering too much, but you can never tell, right? I don't know why that is the case, because there are many people, especially the underprivileged, who've suffered because of the pandemic. Everyone, of course, remembers the big exodus of migrants from the cities. The fact that businesses were closed for an extended period of time, jobs were lost, even formal sector jobs were lost. A lot of middle-class professionals lost their jobs as companies downsized. The recovery that you're seeing in the corporate sector is largely profit-led, which comes from cost reduction. It doesn't come from anything else. And so it's difficult to explain why a lot of this angst that you hear anecdotally isn't translating into what people call hawa, or the way the wind is blowing in politics. I don't know why that is not happening, but it does not seem to be happening anywhere. I'm also not so sure that this particular set of elections is going to be a super spreader event. Sure, large events always run that risk, but I think the Election Commission has learned its lesson from what happened during the second wave, and the kind of restrictions that have been put in place. It's, for instance, it's not allowed any large events till the end of this month. So till January 31, you cannot do any rallies. It's limited the number of people who can attend a meeting, even in a large hall, if it's indoors. And even outdoors. There are limits on indoors, there are limits on outdoors. So I think the Election Commission has been careful this time, learned a lot from the second wave, clearly. And I think parties themselves have been a lot more responsible this time. Even before the Election Commission came out with its restrictions, many of the parties had signaled that they would not be doing large events. So I think everyone's behaved a little more responsibly this time around. So I don't think of course I could be wrong, but I don't think the elections are going to end up being super spreaders, a super spreader event. And of course, to answer your original question, I have no idea why voters don't seem to want to hold their governments accountable for COVID, right? In many of the states, the factors seem to be different. In the largest state which is going to the polls, for instance, which is Uttar Pradesh, it's the same old caste and identity and religious identity issues that are likely to be significant influencers in this election, not how the government managed COVID.
My guest on the show this week is Sukumar Ranganathan. He is editor-in-chief of the Hindustan Times. HT has been our partner in this podcast since the very beginning. We are thrilled to kick off our new season by having Sukumar on. Sukumar, thanks to you and the HT crew for all of your partnership, and thanks for coming on the show.
Thank you, Milan.
Grant Tamasha is a co-production of the Carnegie Endowment for International Peace and the Hindustan Times. This podcast is an HT Smartcast original and is available on htsmartcast.com, India's fastest-growing podcasting platform. You can also find us on Apple Podcasts, Spotify, Stitcher, or wherever you get your podcasts. Don't forget to rate and review. Helps others find the show more easily. For more information about the show and to find the writing we reference on this week's episode, visit our website, granttamasha.com. Production assistance comes from Caroline Duckworth. Tim Martin is our audio engineer, and Cliff J. Pranada is our executive producer. Thanks for listening, and see you next week.
This was a Hindustan Times production brought to you by HT Smartcast.
HT Smartcast.